Welcome to Providence Swedish Weight Loss Services. I'm Dr. Sara Martin del Campo, a bariatric weight loss surgeon.
And I'm Dr. Delilah Strother, a medical weight loss physician.
We are part of Providence Swedish Weight Loss Services, a passionate team of medical providers, surgeons, dietitians, psychologists, and caregivers whose goal is to provide you with a comprehensive approach to treating obesity. We would like to introduce you to our program today.
Let's start by talking about what is obesity. Obesity is a disease of excess fat storage in the body. It is a long-standing, relapsing, multifactorial, and neurobehavioral disease that is highly influenced by genetics and the environment. An increase in body fat causes adverse metabolic, biomechanical, and psychosocial health consequences. It is recognized as a chronic disease that warrants lifelong treatment options. While it has its limitations, obesity is defined in the medical world by a term called body mass index, or BMI, which takes one's weight and height into consideration. A normal BMI is considered between 18.5 to 25, and overweight BMI is between 25 to 30. Class 1 obesity is a BMI of 30 to 35, Class 2 obesity is a BMI of 35 to 40, and Class 3 obesity is a BMI of greater than 40.
Obesity can be caused by a number of different factors, including genetics, the weight-gaining environment, hormonal changes like insulin resistance, abnormal responses to fullness hormones like leptin, or increases in hunger hormones like ghrelin. It can also be caused by medications, medical conditions, a lack of feeling full or satisfied, poor sleep, psychological factors, and social factors. It is truly a disease and not from a lack of self-control.
Unfortunately, obesity can also cause or worsen other medical diseases, including diabetes, sleep apnea, high blood pressure, high cholesterol, heart disease, acid reflux, joint disease, non-alcoholic fatty liver disease, PCOS, infertility, migraines, depression, and cancer. But the good news is that treating obesity through weight loss can help reverse these changes, and in the process prevent or improve many of these other medical conditions.
So let's talk about treatment options for weight loss. There are typically 5 ways that we can help people to lose weight. One of the most common ways people initially try to lose weight are with diet changes. The food we eat does matter. While it does play an important role when it comes to weight loss, unfortunately, diets alone are not very successful long term. The brain has a set point for weight, which is often a person's highest weight. When a person diets to lose below that weight, the brain compensates to try to maintain that set point, similar to how one will shiver to maintain their temperature if they get too cold. To maintain that set point, the brain will cause increased hunger and decreased energy expenditure at rest. For example, a person will burn fewer calories sitting at a desk or while asleep. The more weight you lose, the further you are from your set point and the stronger the biology is to then cause weight gain. So diets alone are not very successful. 9 out of 10 people are unable to maintain even a 5% weight loss for 5 years. However, diet changes can be more successful when we use them in combination with other tools as well.
The next tool for weight management that we talk about is behavior change. We help patients with behaviors around getting quality sleep, stress management, eating behaviors, and developing resiliency with all of these behaviors.
Activity changes are our next tool for weight loss. You don't need to watch a video from a bunch of bariatric doctors to know that exercise is important. It's good for your cognition, longevity, mood. The list is truly endless. With weight loss, one concern is losing muscle mass. we work to help our patients identify strength-building activities that are sustainable to protect against muscle loss.
The fourth tool we have is medical intervention. We've been using anti-obesity medications for 60 years. Some decrease overall appetite, some specifically target nighttime hunger. Some are really beneficial for binge eating episodes, and some of these newer medications are also diabetes and prediabetes medications that can aid in weight loss. There are pros and cons to all medications. Medications can cause side effects, some are costly, and they are not always covered by insurance. The main difficulty with medications is that they require lifelong use to help keep the weight off.
The fifth tool we have is surgery. There are a variety of surgery options available. Some decrease the size of your stomach, some alter absorption of food, and all alter hunger and metabolism hormones to allow you to be more successful with weight loss. There are pros and cons to each surgery. Some may have healing complications. Some may improve, while others may cause acid reflux, and all require lifelong vitamin supplements.
None of the 5 tools we have mentioned, including diet changes, behavior modifications, activity, medications, or surgery, work effectively by themselves. It requires a combination of these tools for anyone to be successful with weight loss. And the goal in our clinic is not just to give you one, but to give you as many of these tools as possible.
Now, when we look at the successes of these 5 tools, on average, the first 3 things, diet, behavior, and activity changes, can lead to somewhere between 3 to 5% total body weight loss.
Medications have evolved in terms of efficacy. Oral options typically lead to a 5 to 10% weight loss, whereas newer injectables typically lead to 10 to 20% weight loss.
On average, bariatric surgery can lead to somewhere between 25 and 40% total body weight loss. Weight loss surgery is the most effective and evidence-based treatment for severe obesity. It has been shown to increase lifespan, improve quality of life, and reverse diabetes in up to 80% of patients. So all the treatment options work to different degrees, but again, none of them are all that successful on their own.
Medications should be considered for patients with a BMI between 27.5 and 40, or in conjunction with surgery for patients with higher BMIs.
Surgery should be considered for all patients wanting a more permanent tool to lose more than 20% of their body weight with a BMI greater than 40, or for those with a BMI of 35 and above with obesity-related medical conditions. Surgery has been shown to be the most permanent, long-term, and cost-effective solution for weight loss.
Depending on your health and weight loss goals, one treatment option may be better than another. In our program, we will introduce you to a team of dietitians, psychologists, medical providers, and/or surgeons with the goal of helping you determine what treatment plan is best for you to reach your goals and provide you with all the tools you need to succeed.
For an appointment, click on the link on our website. We look forward to seeing you soon.